I'm going to start by talking about the incidence of suicide and how it has become a public health crisis for us. We have several slides with a number of different data points on them, and I'm just going to highlight the major points on each of these, and that is that in the United States, the suicide rates increased about 30% between the years 2000 and 2018, and then it declined during 2019 and 2020. But suicide is a leading cause of death in the United States, with 45,000, almost 46,000 deaths in the year 2020. Now, the provisional rates reported by the CDC are that the numbers are actually increasing, actually did increase during 2021 by several percentage points. So even though there had been some progress, it seems that things picked up again during 21, which may not be coincidental or may be due to the pandemic. We know from the data that suicide affects all ages. It's the 9th leading cause of death for people ages 10 to 64, and it was the 2nd leading cause of death for those ages 10 to 14 and 25 to 34. And here's a graphic representation of that if you want to use that as a reference. Race, ethnic, and sexual identity also affect the rates of suicide. The highest rates were among non-Hispanic American Indian and Alaskan and non-Hispanic white populations. And we had higher than average rates of suicide among veterans, people who live in rural areas, and workers in certain industries. Young people who identify as lesbian, gay, bisexual have higher rates of suicidal thoughts and behavior compared to their peers who report being heterosexual. And here is a representation of the rates among the different ethnic groups. Additionally, those who live in rural areas are prone to higher rates of suicide as well. On the map of the United States, as we show here, the darker blue areas show you where the higher rates show. And most of it is in the mountainous regions in the western part of the country, but certainly one of the standouts is the state of West Virginia in the east as having a very high suicide rate, maybe also related to the opioid epidemic, because West Virginia had one of the highest death rates related to the opioid epidemic as well. Male-female breakdowns and the rates among suicide age adjusted for males versus females from the different groups are also represented here.